that'd be great. Yes.
Hi, Senator Steiner-Hayward. Thanks for joining us today. I'm wondering if you can start off by telling us a little bit about Measure 111.
Certainly, I'd be happy to. Measure 111 is, excuse me, a ballot measure that was referred by the legislature through a bill that we passed in 2021. And it would create essentially a constitutional right to healthcare in the Oregon Constitution, analogous to the one that we have for K-12 education. Not require that the state pay for it, mind you, but that the state plays an active role in ensuring that every Oregonian has access to high quality, cost-effective, evidence-based healthcare.
Great. If you can, and actually, Paige, if you wouldn't mind introducing yourself as well.
Absolutely. Good afternoon. My name is Paige Spence, and I'm the Director of Government Relations for the Oregon Nurses Association.
Great, thank you. So if both of you can just kind of tell us why something like this is necessary.
You know, I came into the legislature in late 2011, early 2012, because I believe Oregon can be the healthiest state in the nation. One of the challenges is that many people think of education, healthcare, economic development, transit and transportation as separate, when in fact, they're really inextricably intertwined. We have made consistent progress over the past decade or more in improving the quality of education and improving education funding for kids. But if kids aren't healthy, they can't learn. If their parents aren't healthy, they can't maintain family wage jobs that help them support their families and help their kids thrive. We can't have a robust economy. And healthcare is as fundamental as education to having an overarching healthy society, however you construe that. So this work is work that was started by the late Representative Mitch Greenlick over a decade ago. And I'm really just continuing the work that he started, but he and I shared a passion, as many others do, for ensuring that every Oregonian has access to healthcare, and that we work hard to continue Oregon's incredible progress toward making sure that they have access to health. Every Oregonian has access to healthcare. And this is inextricably intertwined with helping Oregon thrive.
What would this actually change? So if it is in the Constitution, can we expect that there would be a significant new increase then in healthcare?
Well, I'll start, and Paige, you should feel free to chime in anytime. We will not see any changes instantly, right? No matter whenever you pass a bill, whenever you pass a change in the Constitution, you don't see a change instantly. What this would do is change how we think about policies and about budget decisions, to try to think about whether they help us meet that constitutional requirement. I don't think we would see a significant change. Oregon's already doing really well on a whole variety of counts. For example, we have one of the highest rates of insurance of any state in the nation. That's great. And the state plays a big role in that, because we have, at this point, 1 in 3 Oregonians on the Oregon Health Plan, and another almost 400,000 people between the Oregon Educator Benefit Board and the Public Employee Benefit Board. So about 40% of Oregonians actually already receive their health care through state funds one way or another, or a combination of state and federal. But having insurance does not necessarily guarantee access. We know that we have healthcare deserts in this state. We know that our primary care system is overstretched. And we need to be thinking about how do we change all of those things to ensure that having good health insurance means having good access to healthcare.
Yeah, and I'll chime in there as well. I think the senator has said everything right so far. O&A would agree with all of that. And, you know, Measure 111 would not establish a specific program or solution, right? So to the question of whether it creates immediate change, it does not. But what it does is affirms Oregonians' values by enshrining the right to healthcare in our Constitution. And so if voters approve it, Oregon's leaders, like the senator, will work together with the other brightest minds in healthcare to come up with the policy solutions to make sure that every Oregonian does have access to high quality, affordable healthcare. And I think we already see pretty clearly that Measure 111 reflects Oregonians' values and the belief in our state that everyone deserves access to affordable healthcare. You know, and the senator alluded to the number of folks that have health insurance in some way already supplied by or assisted by the government. But and to expand on that, Oregonians have acted already to protect healthcare for women, children, immigrants, seniors, people with disabilities. And so this measure would aim to close those final gaps in affirming all of those values by enshrining the right to healthcare in the state constitution, which is arguably our most important governing document.
So, Senator, do you know how much every biennium the state spends on healthcare?
I think it depends a little bit on how you define healthcare, Helen.
Mm-hmm.
We put well over $1 billion into the Oregon Health Plan of General Fund. That does not include the money that comes from the provider taxes from the hospitals and that we use to leverage federal funds. That does not include the money that we push towards public health. That does not include additional investments in behavioral health. So I think, I mean, I'd have to be guessing. I'm not, and I don't love guessing about budget, but it's well north of $2 billion. And it's probably more like 3.5. I'd have to go back and add up all those numbers, but it's a lot of money.
And is that, does that also include public employees' health benefits?
No, that doesn't even include that.
So it's several billion a year already is what the state is devoting towards healthcare expenditures.
Well, that was a biennial number that I was giving you. So maybe you say 2 billion a year. 1.5 to 2 billion a year is probably my best guess, but it's a guess. And I would really not want people quoting me on that. I'd have to go back and comb through the entire legislatively adopted budget and legislatively approved budget for between 2021 and 2022 sessions, because we added more, for example, for behavioral health in 2022. So it's a lot.
Would you say, is it more than what the state spends on education, for instance?
No, absolutely not. Absolutely not. We spend over $9 billion a biennium on public education just for K-12. That does not include preschool promise, Oregon pre-K, a variety of other early intervention programs for kids with special needs. That does not include the Community College Support Fund. That does not include the higher education, the Public University Support Fund. So no, we spend way more on public education than we do on healthcare.
So by making this a constitutional amendment, is there a risk that additional funds could be taken from education to fund healthcare, since education is getting more? There
is a specific clause. I didn't mean to interrupt you. I apologize.
Oh, but that's okay.
It's a good question. It's one we made a point to prevent. That one of the clauses in the measure says that the requirement for the state to provide health, to ensure access to healthcare, needs to be balanced against the pre-existing requirements for the state to provide education and other services. For example, the very first thing we have to pay for is the people who are incarcerated, right? We spend billions of dollars per biennium on incarcerating Oregonians because of things like Measure 11 and Measure 57. So it's just those are things that we already have to take off the top, and we do that. But public education is a very high priority to Oregonians, and we've made substantial commitments to that we intend to continue to keep. You cannot be healthy if you're not well educated. Conversely, you can't be well educated if you're not healthy.
And people would also say housing as well. You can't, you can't be healthy, you can't be well educated if you don't have stable housing. So why not, for instance, a constitutional amendment about the right for housing for every Oregonian?
That's a great question. We think that health and education are the two most fundamental things that we can do. And I would argue pretty strongly that as we look toward future policy, investments in housing are part of the state's commitment to ensuring access to healthcare. And we need to make sure that that affordable housing is available. We've been making substantial investments. We've invested billions of dollars over the past several biennia in a variety of publicly supported housing, whether that's the LIFT program, which is a public-private partnership, or permanent supportive housing, where we provide wraparound services for people with severe persistent mental illness or who are transitioning off of the streets into permanent housing. Those are all part of ensuring that every Oregonian is healthy. And we will continue to do that. And that's part of what I was saying. As we look at these investments in the future, we will be looking at them with through the lens of this constitutional requirement for health.
At the same time, there are, I mean, what it sounds like is that there would be motivation or potentially a need to raise additional funds in order to meet this constitutional standard. Because as you know, looking at the wording of this, it says it is the obligation of the state to ensure that every resident of Oregon has access to cost-effective, clinically appropriate, and affordable health care as a fundamental right. We don't have that. Rural areas, you know, mental health services. You know, we've been running stories lately about how hospitals are losing hundreds of millions of dollars in just the first half of this year. So I guess the question is this basically a, you know, cementing into the Constitution something that says, a message to Oregonians, we're going to have to raise taxes in order to meet the standard?
No, 100% not. Paige, you want to start or you want me to start?
You're the budget expert here, Senator, but I'll just chime in to say, I think what's really important here, among other things, is that the measure does not increase taxes. And as the senator can speak to, there are many ways to balance the budget and to appropriate funds that do not require raising taxes. And so, you know, again, this measure just puts the principle in the Constitution and then kind of brings the task back to the legislature to figure out the best ways to do that. And I think that the voters will support that. And I do want to be clear, there's no tax or other revenue raising measure associated with this measure. You know, and again, I work for the Oregon Nurses Association, and our nurses care for people across the state who know that health impacts do not discriminate across income level, housing status, race, sexual orientation. Everyone benefits from having access to healthcare. And I think that, you know, we all agree that no one should go broke because they got sick. And the healthcare is a foundational right. And so we want folks to be able to access healthcare because our nurses are seeing people in hospitals and other settings who could be treated more effectively and affordably if they had access to preventative healthcare, which all, of course, strengthens our communities and strengthens our economy as well.
And I would agree. I think what this does is it gives the state further convening power to bring together a wide variety of interest groups and stakeholders, whether that's the hospitals or the medical associations, the specialty associations, large employers, right? It gives us an opportunity to bring people together to think more constructively. There is a lot of money there's more than enough money in our health system right now to provide healthcare for every Oregonian, right? We just have to be smarter about how we use that money. And I'm not talking about single payer. I'm just talking about thinking collaboratively, as we've been doing in the state for a long time. There's a reason we passed, for example, the bill that requires cost containment in our healthcare system as a whole, not just in our CCOs, not just in our Medicaid system, because we think that we have an unsustainable rate of growth in healthcare, and we need to be looking at that. Obviously, the inflation currently makes that a little bit more challenging, but we need to be thinking collaboratively as a group. This is not a one entity solution. It just gives us an opportunity to have a more robust conversation.
Doesn't the state already have that authority and that ability to convene groups? I mean, there have been a number of times where they have done that in the past because of funding issues. Measure 101 is an example, for instance. So why do you need a constitutional amendment, which, you know, again, reading it, it sounds like it could also open the door to a lot of lawsuits. You're saying that it's the obligation of the state to ensure that every resident of Oregon has access to cost-effective, clinically appropriate, and affordable healthcare as a fundamental right. How does that not create the right to sue for every single person who lives in Oregon?
I can speak to that. You know, so I think we're talking about the Hope Amendment, and the Hope Amendment does not create a private right of action for individuals to file lawsuits against other individuals, companies, or the government. The Supreme Court has been very clear that it will not create a private right of action under the Oregon Constitution. So I think that's kind of the underpinning here. It's possible that the court could be asked for a declaratory ruling under the already existing Declaratory Judgment Act. But individuals filing suit theoretically against the state pursuant to Measure 111 would be asking the court to declare what the law requires, which would require, you know, a pretty broad challenge that would be more than the impact to any individual circumstance. So, I mean, I think the courts would be more likely to consider cases where policies or infringing on the rights of people who share a common circumstance. But, so sure, for example, that can occur when a specialty drug is unaffordable to people who have a life-threatening condition, let's say. But these situations aren't really common enough to be described as a waive. And so instead, the Oregon Supreme Court, once they identify what the Hope Amendment requires, it's unlikely that there would be a multitude of lawsuits. And I think, similarly, to the budget question, I don't think the Supreme Court or any other court in Oregon, of course, then could require the state to budget more for healthcare if this measure passed. The Supreme Court, in my perspective, has a history of deferring to the state legislature to define the terms of constitutional amendments in statute. There's several cases there kind of related to school funding more than anything else. But so anyway, that's a long way of saying if past precedent of the Supreme Court is the best indication of future behavior, it seems unlikely to me that there would be a private right of action created or a funding mandate.
I think the other thing I would put on the record to go with, thank goodness Paige is a lawyer. We're a good team, she and I. And the thing that I would say is, the reality is anybody can sue about anything. But as Paige articulated very clearly, this does not create a private right of action. And the legislative record is very, very clear over the years that Representative Greenlight tried to pass this and our work in 2021, that this does not create a direct mandate to the state to actually provide the healthcare or pay for the healthcare.
So then why have it? I mean, I guess you're saying both things. You're saying that it's not going to require anything really.
No, because I'm gonna jump in for a second here. About a third of states already have this in their constitutions. Some for a long time, some newer. There are data that show, for example, that if you look at infant mortality rates before a state puts something like this into its constitution and after, infant mortality rates drop. And that's particularly true in communities of color. Even if there is no explicit legislation directly related to that constitutional right, because it changes how legislators, policymakers, and executive branch agencies think about the requirements. And it helps them prioritize things that will change the dynamic of how people become healthy in this state. So we know that simply having something in the Constitution changes how people think about things. It influences subtle decisions about policy and budget that in the long term make a big difference in the well-being of Oregonians.
So Washington State has a constitutional amendment regarding ample funding of public education that triggered a lawsuit that ultimately resulted in billions of dollars more being spent on Washington's public education system. How is this different? How is this worded to guard against that same kind of outcome where the Supreme Court, which has I think you would find people who would say has been generally thoughtful about what the legislature has said, or about their interpretations, said that no, this is not meeting the standard of what the Constitution calls for. How is this different?
I think that's a tricky parallel. I think it's really different. I think that's a tricky parallel to draw because, obviously every state's governing documents and courts' interpretations thereof are different. And so it's not apples to apples when we compare state by state analysis, but in the Washington Supreme Court, it was a 2012 state Supreme Court decision that had protected funding for basic education. And the court in that decision held that the education budget could only be cut for academic reasons and not for budget reasons. And we just don't have that, in my mind, a similar precedent in Oregon on this point.
So you feel very confident that this would not result in the same kind of Supreme Court saying you're not fulfilling your constitutional obligation?
I do, yeah.
Okay. Is part of this a kind of looking at those who have are in favor of it? You've got a lot of people who would personally benefit, or I shouldn't say personally, but their businesses, their hospitals, the healthcare system, et cetera, would benefit from this. Are there other supporters that would, for instance, like consumer advocacy groups, or who are some of the other supporters that are sort of outside of this industry?
There are a lot of them. I mean, Healthcare for All Oregon, that has been advocating for improved access to healthcare in the state for more than 20 years. I mean, they were the proponents behind ballot measure 26 in 2002.
And are they in favor of single payer?
They are, but this ballot measure does not promote single payer. I want to be really clear about that. That is not the intent of this, is to get to, they may be supporting it because they think it might get us closer to single payer, but I can tell you that I've been very clear on the record that that is not my intent with this. So, but there are also, I don't have the list in front of me, but I believe that groups like APANO, which is the Asian Pacific Islander group, the Coalition of Communities of Color, a variety of other organizations. Paige, do you have the list in front of you? Maybe you do.
I don't have a list of endorsements. ONA, of course, the Oregon Nurses Association, is one supporter of the campaign. I don't work for the campaign, but you know, I think we're joined by a number of the other labor unions, including SEIU, Local 49, and maybe 503, but don't quote me on that as well, although I guess we're on video, and UFCW and SEIU, and also we have Oregon Nurses Association is an AFT affiliate, as is another nursing union that's smaller but still very important in the state, which is OFNHP. So all of these groups together, and I would say not because we're healthcare unions specifically, right? I mean, SEIU, UFCW, all those folks have some workers in the healthcare system, but also just workers who make various wages and who would benefit from having you know, extended options for providing healthcare. So I think, as Elizabeth said, I mean, there's community of color and equity groups who are just looking at making sure that that workers, that individual people have healthcare, but not with anything to gain financially as an entity. And I'll be very clear that Oregon Nurses Association doesn't, you know, stand to gain anything financially from this measure either. If anything, it'll just be our time, right, to make sure that any next steps that the legislature takes to enact policy or legislation around the measure, that we're at the table and able to, again, collaborate with Elizabeth and, Senator Steiner-Hayward and her colleagues, right, who are really good at this stuff fiscally and on health policy.
Okay. Although public employee unions, many of their employees, like teachers, for instance, their premiums are picked up by the state. Is that right?
Well, they're picked up by all of us, right? We all pay those taxes. Those are our all of our taxes.
Right.
And so, yes, I mean, I mentioned earlier that the state's already, in essence, providing healthcare for about 40% of Oregonians, and that includes Oregon Educator Benefit Board beneficiaries, individuals and their families, and the Public Employee Benefit Board beneficiaries, and our families. So yeah, I mean, yes, your tax dollars, my tax dollars, we're all paying for that now. And I think the real issue is about articulating a value that Oregonians have already made clear. The Constitution is supposed to be about values. Oregon's Constitution has had a bunch of stuff amended into it that's really policy, right? Measure 11 is a great example of that. Measure 5 is a great example of that. We've had a lot of amendments that are really policy and should have been done by the legislature. This is a value statement. And it says what Oregonians have been saying for years, starting way back when we implemented the Oregon Health Plan in the early 1990s. And ever since, Oregonians have said time and time and time again, across the entire state, this is not a rural, urban, red or blue. This is about Oregonians understand that their friends, neighbors, family members all should have access to affordable healthcare. And that's what we've been doing in this state better than almost any other state in the nation. And we're putting that value into our Constitution.
And I guess part of that is just sort of all of these terms are really up for interpretation. Cost effective. Does cost effective mean that someone who has their premiums already paid for should not have to all of a sudden should not have to actually take on any part of that cost going forward? That's the question. Clinically appropriate, things that are experimental in nature or something, you know, does that create the requirement that the state must make that available to someone. Affordable, what is affordable healthcare? I mean, I guess there's all these questions. And really what it comes down to is Senator, are you willing to state that this will not result in any increase in taxes, that passing this is not going to be used to justify an increase in taxes ever?
No, I cannot guarantee that. I will not state that because I don't know what's going to happen 5, 10, 15, 20 years from now. I can say that it is not my personal intent, nor that of any of the other supporters, to require new taxes to pay for this.
But how do you provide this?
I cannot speak for future legislatures, Helen. I just can't, right?
But how do you provide this then? I mean, you said that there's plenty of money, but how do you?
We're already doing it to a large extent. But what it allows us to do is just think about it in a slightly different way and be clear that the Oregon Constitution says that Oregonians hold this value, right? This is a value that we believe in. It's like the Bill of Rights in the US Constitution, right? Some of that's been interpreted in ways that are complicated, but I think that we have an opportunity to continue to have these conversations. Every conversation, Oregon is a very transparent state overall. Do we have times when we're not quite as perfect about that? Sure. But in general, transparency and public engagement in important conversations like this is very high in Oregon. And that's as it should be, because these are conversations that everyday Oregonians should be involved in. And as long as I'm in the legislature or involved in this health policy work, I can guarantee you that I'm going to push hard for robust public engagement at every level in every corner of this state. Because that's what's important. And that's one of the other things that Oregonians have proven time and time again. They want to be involved. And we as the legislature want them to be involved in these conversations. So can I guarantee no new taxes? No, I don't make promises like that. I don't. But is it our intent to create some brand new healthcare system that's going to require a ton of funding? Nope. That is, I can guarantee you that that's not our intent at all.
And your belief is that the state can achieve what's laid out in this constitutional amendment with the resources it has now, like in the immediate future?
I think in the immediate future, yes. And just to get back to something you said earlier about cost-effective healthcare, clinically appropriate, we've been defining that in this state for 30 years, right? With the Health Evidence Review Commission, with the HERC, right? For Oregon Health Plan. Oregon Health Plan has done a remarkable job for 30 years providing evidence-based, cost-effective healthcare for millions of Oregonians, millions, right? And that's been shown time and time and time again to be justifiable. Our process is transparent about how things end up on the list or they don't end up on the list. We work really hard to adjust it as appropriate when new treatments become available that we think are actually evidence-based and make sense to include. We make adjustments, right? But experimental things, those are supposed to be paid for by the clinical trials anyway, right? They're not supposed to be paid for by regular health insurance, and they're not currently, and they wouldn't be under this. Right?
Yeah, oh, sorry, Elizabeth.
Go ahead, no, please.
Yeah, I was just going to chime in. I mean, I agree with all of that. And Elizabeth said, I think Senator Steiner-Hayward, we're having these personal relationships. The senator is absolutely right that those terms are well defined in statute already. And I think that our state government does a really judicious job and a thorough process in an open and transparent way about the state budget. And I think that what Elizabeth is saying here too is that, Measure 111, again, on its face does not increase taxes and does not require any concrete action that would require the levying of taxes in the immediate future. So while I think our state budget is very carefully balanced and that funds are dedicated to all the broad range of public services that Oregonians need and demand, this is just one step. Measure 111 is one step, right? So the Hope Amendment, which is what Measure 111 would bring to the Constitution, again, doesn't establish a specific program or solution. And healthcare is getting more expensive, and so if we can act now and act soon, then we can make smart decisions that provide healthcare as a human right without having to compromise the state budget. I think it's more important than ever that we have this amendment, as a backstop. And what what my hope is that Oregonians, by voting for Measure 111, are going to send a clear message to the legislature that perhaps it is time, right, to re-examine certain elements of the budget to make sure that we are prioritizing healthcare as a human right in the state budget, and that budget being a value statement will reflect that back to voters.
If I could just say something, I think we've done a really good job prioritizing healthcare in our state budget. We make robust investments every single biennium, and they've only been increasing. So I'm not so concerned that we haven't been prioritizing it in the right ways. I think that there's definitely work we can do as we think about bills that come through over time to say, does this help us reach that constitutional goal, right? We think about that with education all the time. We do. And when I'm looking at bills that come through Ways and Means, when we're thinking about bills that are straight policy bills that don't have a fiscal, when I'm thinking about the overarching state budget, I'm thinking about that constitutional requirement that we educate Oregon's children, right? And I think that's really, really important, and we will continue to do that. And this will allow us to also prioritize thinking about how do we make sure Oregonians can stay healthy.
Great, thank you. Laura, did you have any questions?
How do I get my mute button undone? That's my question. No, I think I'm good. Thank you. And I really appreciate this robust conversation. It's been very good.
Yeah, we appreciate the questions and the opportunity to talk with you.
Great, thanks very much. I'll follow up if I have any other additional questions, but I appreciate your time.
Thanks a lot.
Thank you.
Take care.
Thank you. Good to see you.
Bye-bye.